Celecoxib is a nonsteroidal anti-inflammatory drug and SAID, with pharmacological properties primarily related to its action on the cyclooxygenase 2 enzyme. Celecoxib selectively inhibits the COX-2 enzyme, which is responsible for the production of prostaglandins involved in inflammation and pain. Unlike traditional NSAIDs, it spares the COX-1 enzyme, which is involved in the production of protective prostaglandins in the stomach. By inhibiting COX-2, celecoxib reduces the synthesis of pro-inflammatory prostaglandins. This leads to a decrease in inflammation, which is beneficial in conditions like arthritis. Celecoxib also has analgesic pain-relieving properties, making it effective in managing various types of pain, including musculoskeletal pain and postoperative pain. It can help reduce fever by lowering prostaglandin levels in the hypothalamus, which is the body's temperature-regulating center. It's important to note that celecoxib can have cardiovascular effects. Prolonged use or high doses may increase the risk of cardiovascular events like heart attacks and strokes, especially in individuals with pre-existing cardiovascular conditions. Celecoxib is metabolized primarily in the liver, mainly by the cytochrome P450 enzyme system. It has a half-life of around 11 hours. The metabolites are eliminated through both feces and urine. Celecoxib's duration of action is usually such that it can be taken once or twice daily, depending on the prescribed dosage. It is commonly prescribed for conditions like osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, and acute pain. It is also sometimes used to reduce the number of adenomatous colorectal polyps in familial adenomatous polyposis FAP. Common side effects of celecoxib may include 1. Stomach upset or pain, 2. Heartburn, 3. Diarrhea, 4. Gas, 5. Dizziness, 6. Swelling of the ankles, feet, or legs edema. More serious side effects can occur, but are less common. These can include 1. Allergic reactions, rash, itching, swelling, severe dizziness, trouble breathing. 2. Chest pain. 3. Black or bloody stools. 4. Persistent stomach or abdominal pain. 5. Vision changes. 6. Unexplained weight gain. 7. Signs of kidney problems, e.g., change in the amount of urine. Common drug interactions with celecoxib include aspirin. Combining celecoxib with aspirin may increase the risk of gastrointestinal bleeding and ulcers. Some individuals take low-dose aspirin for cardiovascular protection, so it's essential to discuss this with your healthcare provider. Other NSAIDs, nonsteroidal anti-inflammatory drugs, using multiple NSAIDs together, such as ibuprofen or naproxen, can heighten the risk of gastrointestinal issues like bleeding and ulcers. Anticoagulants and antiplatelet drugs. Celecoxib can potentially interact with blood thinners like warfarin, heparin, and antiplatelet medications, increasing the risk of bleeding. Close monitoring and dosage adjustments may be necessary. Corticosteroids. Combining celecoxib with corticosteroids like prednisone can increase the risk of gastrointestinal ulcers and bleeding. ACE inhibitors and ARBS. Celecoxib can reduce the effectiveness of blood pressure medications like ACE inhibitors and angiotensin receptor blockers ARBS, potentially leading to increased blood pressure. Diuretics water pills. Combining celecoxib with diuretics may reduce the diuretic's effectiveness and increase the risk of kidney problems. Here are some general guidelines for the maximum daily doses of celecoxib for common conditions. Osteoarthritis. The maximum recommended dose for osteoarthritis is typically 200 milligrams taken twice daily. For a total daily dose of 400 milligrams, rheumatoid arthritis. For rheumatoid arthritis, the maximum recommended dose is also typically 200 milligrams taken twice daily, for a total daily dose of 400 mg. Ankylosing spondylitis. The maximum recommended dose for ankylosing spondylitis is often 200 milligrams taken once daily, but in some cases, Your healthcare provider may prescribe 400 milligrams as the total daily dose. Acute pain or dysmenorrhea menstrual cramps for the relief of acute pain or dysmenorrhea. The maximum recommended dose on the first day is usually 400 milligrams as a single dose, followed by 200 milligrams as needed on subsequent days. The total daily dose should not exceed 400 milligrams. Familial adenomatous polyposis FAP. In the case of FAP, the maximum recommended dose is typically 400 milligrams taken twice daily, for a total daily dose of 800 milligrams.